demonstrate an exercise, an activity that I like for almost all of my shoulder patients, my operative shoulder patients. One of the more difficult positions to obtain after shoulder surgery is to get the arm up above the level of the shoulder. And I frequently don't want a person actively trying to bring the arm up. For example, after a rotator cuff repair, I don't want to activate the muscles that were just repaired. So a good way to get the range of motion, retain the range of motion after surgery, is to come out of the sling and put your elbow up on a table. Let's pretend this is a table at home, a wooden table or a breakfast bar. And I like to put a towel under the forearm to help to prevent friction. So what I'm going to do is I'm going to bend forward slowly at the waist and watch what happens to my arm. So I'm bending forward at the waist. Now I'm going to exaggerate this a little bit. I'm going to move pretty far forward and look at the position of my arm. It's pretty high up there, and I haven't actively engaged any of the muscles. I haven't jeopardized the repair. And what I might do is just hold it there for a moment, maybe sink into it. 1, 2, 3. Back on up to where it's comfortable. Wait, and then do it again. And that's called a table slide, and I really like the table slide for almost any shoulder operation. Another thing I'd like to point out is that this position is really good for hygiene. In other words, you want to clean under your arm. This is a good resting position. Usually it doesn't involve much discomfort, so you can do this at home for hygiene. And that's a position, but the table slide is an activity. And here's what it's not. It's not me pushing my arm out actively. It's not that at all, because that involves using these muscles, which I don't want to use. I would like to do this passive motion at the shoulder. I'm bending forward at the waist. Another thing I don't want you to do is to go past the neutral position. We don't need that early on. So have the shoulder in neutral, bend at the waist, shoulder slide. Thanks.